Minister Selebe Muchaberno, Minister of Health of Lesotho, Your Excellencies, distinguished delegates, representatives of all countries in here, representing your country in different capacities, state ministers, director generals, esteemed colleagues, friends, but most importantly also our Pan-African Healthcare Forum representatives who are here, and also most importantly, the PASHE leader, Your Excellency. We would call Your Excellency today. I know for Professor, he's always like, oh, don't do that. But we will call Your Excellency for today because this is a momentum that brought everyone together in here. PASHE, and when it was posted and hosted over the last 3 years, this is the third time that we are having it in here, but I'm also very honored. I want to say thank you again, though they are not in the room. Our representatives from Rwanda, definitely you would take this message back to His Excellency Minister Saban for ensuring that this is a momentum that continued. Please allow me and join me in saying thank you to the team who brought this to the third room. Sitting over there, I was just thinking, and maybe I want to ask you to think out of the regular speech that we would prepare. How many of you had a surgery? I will stand with myself. How many of us in this room had an anesthesia without a surgery? For some procedures, of course. How many of us in this room were the surgeons? How many of us were on the other side when our parents or family members or someone very close to us was inside an OR that we have to be worried or thinking that if the procedures will go smooth or not? We're not talking about just policies. It is about things that are very connected to us. Some of us, as I, were a patient sitting on the other side, usually on the other side during the surgery previously before my current capacity. But I was also a patient where I have to give my life and my decision to someone to do surgery, trusting that I would wake up after a general anesthesia. It is about trusting each other. It is about knowing that someone that you give your life decision is going to do a procedure, not just a procedure, but a life-saving procedure in your body. It is a profound honor for Ethiopia, the land of origins, the land where our heads of states meet every year to discuss about very critical issues in our continent. And would there be any other topic that would not resonate with everyone than talking about safe surgery? We were either on this side or the other side, or being worried if someone that we love would come out safe from a surgery. On behalf of the government of Ethiopia and the people of Ethiopia, really welcome you to this beautiful and historic gathering, a platform that reflects our shared commitment, a commitment to care for others, and knowing that one day, I wish that it doesn't happen to anyone, but you could be on the other side, which also happened to me. So, surgical health is a cornerstone of our universal healthcare coverage. We've been talking about it in different states. We've been saying that this is a universal healthcare agenda. It has been an agenda in different platforms at the World Health Assembly, as we have even seen at the UN General Assembly in different forms. But in the WHO agendas, during the WHS, even recently in 2023, it was a very recent agenda because we were talking about safe surgery and emergencies. Excellencies, PASHE, I really liked the agenda and the way it was framed because it wasn't crafted in a way that we will be pleasing someone. You understand what I mean? Because sometimes agendas are set not from the government's perspective or from the user's perspective, which Africa is now loudly saying that it should be shaped by government's priority. And government's priority is about people priority. What do our people need? What do the continent need? How can we change the history that we have seen earlier during the presentation? We have a very limited resource, and we can't hide it. We have very few trained professionals in the continent, and we're not even keeping them as we wish. The attrition issue is an issue that many of us in the room and beyond, when I sit with some colleagues of mine, my fellow ministers, in different stages, we will have a breakout and we will be having our informal discussion on how things are going back at home. And the usual challenge is about workforce. How do we keep the workforce motivated, competent, but also compensated? This is about a dedication. And policies have been in place in very few countries, but it started to change over the past few years. Post-COVID, we started to understand that the surgical care enablers were started to be more looked. They were overlooked over the years during our practice. Many of the OR facilities, many of the pre-op preparation rooms are not a place that we want to be treated and are not usually fit enough for the purpose that we want to see for the next generation. So we're not talking about the setup that is available as fancy ones that you would see somewhere, but this is usually a place where the surgeons would be spending most of their time, and providers and statisticians, nurses, scrub nurse, the team, the cleaners, everyone would be running, but confined in a very small room, but a very beautiful room in my heart, because that's where I usually get myself connected to being trusted. You are more trusted and being given the opportunity to operate when someone is not operating, even thinking or doing anything, because we don't know. I mean, even when I was asleep with the anesthesia, I don't remember what I was thinking. So that is a parade that we've been entrusted as professionals. So this is not only about bringing policy to action, but also understanding what is the commitment, what is the trust that professionals were also given over the years. The government of Rwanda has graciously hosted the first two PASHEFs, and it was more about bringing the momentum and ensuring that at least member states are making it an agenda at the ministerial level. And, but we have continental bodies. We have the African Union, we have the African CDC, WHO, Afro, if we're just talking about continental entities. About the financial side, we also have the other entities from the AU, and also the AU Chair Commission of Health is also tasked to help us to chair and to lead around and discuss around what are the priorities on health in our continent. Excellencies, the board members have ensured that this is not going to be just a one country or one side of the continent where the Francophone side is not going to be represented or the Louisianaphone community is not represented. But later on, we'll definitely expand because we also have continental entities on the professional side, like COSEXA, EXACOG. We have also the ophthalmology societies, all other surgical associations, the anesthesia ones on the region, and the private sector side. You have seen how loud and how precisely they spoke from the private sector engagement side, because this is beyond the African side. They now have the East African side, but beyond this, we're also discussing at the global level on how to ensure sustainability. The challenge before us remains immense, from workforce development, ensuring that this is about commitment, continuity, and this is about shared collaboration. Collaboration, commitment, continuity. Continuity was proved when we hosted the third PASHEF in here, but the collaboration side, we have to still see in depth, and the enablers are in our existing entities at the continent, at the African Union. where our heads of states will be given detailed areas where the collaboration from the Ministry of Finance, thank you for representatives who joined us from Ministry of Finance of our continent, on how infrastructure, how other enablers are available at the institutions that we want to see, because this is beyond the healthcare side. A patient or a client who's coming to you for a first evaluation, you don't know until they arrive to your facility, or a patient who wants to have a surgical care for oncology, they need a prevention side ahead before they arrive to you for surgical care. So nearly, as we have heard earlier, nearly 93% of our people in the sub-Saharan side cannot access surgery when they need it. It is about ensuring access. And access does not come just by discussing in a room like this, where resolutions can be out, and we can say they add this resolution, X and Y and Z resolution, but they can only be achieved when we sit together, plan, execute, and continue to ensure that they are on the table, and we discuss and check if they are delivered or not. We have community which is still needing access. So for Ethiopia, we're ensuring, and this is going to be a call for action for the continent also, that we will be focusing on 5 things. First is healthcare financing. Access, retention, reduction of attrition, everything. Access to commodities cannot be achieved unless we start speaking and earlier crafting the way we want to go in healthcare financing. So we are already making it an agenda, and with that we have already started with changing our policy, our enabling environment, and then we will definitely go in depth in our healthcare reform on how to have a sustainable healthcare financing. Because government cannot be the only leader on this journey. In many of the African continent, except when third parties or donors are driving the agenda, you would see government being the one who would be giving more of the care, and that's why it is having a largest pressure and where the needs are still unmet. So we need to find a way that we have people to people, people to government, and government to private partnership. Because when people combine, when people come together, they come up with idea, and the access is going to be solved when the community owns the agenda. So when I say people to people, it is about bringing everyone together, not just professionals, not decision makers, but the community itself driving the agenda. So healthcare financing is a bigger agenda for us, and this is going to be a discussion. And as I've seen, this is also part of the discussion in from policy to action agenda. Definitely during the next days, you will be having an in-depth with our team on how we are thinking ahead, on how we are envisioning primary health care, how we are envisioning general care, how we are also envisioning higher level cares, tertiary, quaternary, name whatever care you can bring in here. But let me give you an idea and a reflection on what happened recently. Last year only, in our country, I love talking about my continent, so I was about to say in our continent. In our country, we had more than 3,000 surgeries, very difficult and complicated surgeries that would have needed an overseas treatment being done within the country because we had a collaboration. We worked with private sectors, we worked with volunteers who came overseas. Some were diasporas, some were everyone who joined our hands together, as you have seen with the other partners that you see and hear, that we joined our hands. And we operated 3,000 surgeries. I'm just giving you the most complicated ones that would have required an overseas treatment. But for the screening and the regular care, more than 5 million voluntary services were provided, just in a period of summer volunteerism initiative. And we called it a 2-period initiative. 2 summer. When the summer is on the other side of the world, it's summer in here, winter in here. When summer heat in here, it is the other way around. So we use the 2 summer initiative so that people can come and our collaboration continues. So it is part of an innovative financial modality, but it's not sustainable. But it is also a way of creating tools in our surgeons and our trainees, because they get trained in here. They will be trained in their land, and also the trainers will understand the context. It is not going to be something that they will be understanding from a different side. The second one is about health workforce, healthcare financing, health workforce. Health workforce is a big agenda, not only for our side of the continent, but everywhere in the world. But how are we getting prepared? Do we have a strategy in place? What are the threats? What are the opportunities that are existing? The collaboration that we can bring together, the continuity, because collaboration can come sometime, and then the continuity is the usual challenge that my fellow ministers in different corners of the continent are also facing a challenge. Because continuity in workforce, continuity in financing, because I have to connect both, have to be started to be taught from in to out. Otherwise, the sustainability is going to be the most difficult one. If our professionals are not covered and are not entrepreneurs themselves on how to have the way that we can care for the most vulnerable, the most poor, but how do we also use the existing opportunities and skills so that we can reduce the overseas treatment? And you know, there are several communities who could have got a treatment within their country, and they can also pay, and that way our professionals can get paid, plus the other communities that we want to cover with universal healthcare coverage can also get more access. So the workforce is a plan that we have to do at all levels, at a governmental level, at a continental discussion point, because the usual attrition that is coming now in our continent is cross-country, within the continent, while previously it was the other way around. But we can also use it as an opportunity, because this is a sustainable one. If we have more trainees in here who would understand the culture and the way Africa functions, we are 100% the same. I will say 100%. We are the same, by the way. The disease burden, the way our challenges are set, the way our opportunities can arise, our innovations are coming out, are almost similar. This is a way that we can have a continental agenda, workforce-related agendas. We're already starting to brainstorm with like-minded ministers on how to keep the workforce agenda and how we can share at a continental level. And we will be using colleges and existing structures so that we can have a continental platform. But sustainability is a critical issue, and entrepreneurship of our professionals is very serious. So it has to be both ways, from the government side, but also from the professional side, because demands are everywhere. Talents are very small when it comes to this side, but on the other sides, we will say talents are everywhere, opportunities are rare. But for us, it's the other way around. So everyone has to be on the same table, because resources are limited. Third is about primary health care. The more we do prevention, the more we strengthen our community, we definitely can change the trajectory in surgical care and surgical safety. That's why you would be hearing from my team on how we are increasing access at a primary level, more cesarean section being done at a primary level. That's why we are having more OR tables and operation rooms and many of the facilities that previously we wouldn't have thought of. Of course, resources needed, more trained professionals are needed, but bringing surgical and operative cares more closer to the primary care can be a way out for us, because we have also an imbalance of unemployed professionals, which we could use very efficiently with this approach. So this is also about changing the mentality around where professionals have to sit. Where digital health is the fourth one, it is our enabler. It would be our way of investment, because we don't even know the exact data on our disease burden in the continent. We'll have to do several demographic health surveys so that we can also bring and come up with the disease burden of the countries, which is being challenged recently, as you know, with the financial shifts and the global landscape changing. When we don't have supports continuing, the only way out for us is to invest maybe ahead on digitalization. It could be expensive at first, but this is a platform that we would use both for training, having data on our hands, and that would inform our policy. With that, we can also reach very closely to the primary side. We'll be using professionals, so this is also a call to action to you on how to integrate digitalization in reaching to the far and to do a skills skill transfer, and also task sharing to the other communities until we balance the numbers and the percentage that we have seen. That we have to let go of some things until we were able to reach everyone with the highest quality and the highest trained professionals. But definitely we have to also prepare on the professional trajectory for our trainees and our practitioners. And the fifth one is about local manufacturing. Surgical care, everything, medical care, health care cannot sustain unless Africa starts to produce. Previously, our professionals were from the other side of the continent, but it's changing. We are already producing. So local manufacturing is not only the agenda on medical care and medical equipments, but also training our professionals here. The more we train in here, the more we would have the capacity to ensure that this is also trickled to many professionals that can stay within the country and the continent. But local manufacturing for the goods and the materials you want to use are also a big agenda for us. So I'm just giving you a highlight on the 5 key priorities of our country and our commitment and my commitment as a minister to ensure that I work and we work very closely with the ministers of the continent, because this is already set in many of the discussions we have. For this, we want reduction of inefficiencies. We want more integration, no silos, no vertical programs as before. And this is a loud voice that we are setting everywhere. We need integration, integration, integration. We're very happy with the subspecialties that we are having on the continent because it's increasing quality of care, but we have to really sit and discuss on are we really having integration of our training, even on the training side, even on our clinics, even on our different ways, because we have to learn from the different trajectories that we have already started to see in the communicable diseases, the non-communicable disease programs that the continent has faced. But how are we thinking on the surgical side on integration? What are the integration platforms that we are already thinking on the surgical discussion? Ahead of time, we can pave the way and we can reduce the inefficiencies. Definitely, we need high-skilled trained professionals, but we have to really discuss, are we really making it sustainable for the continent to keep on this momentum? Thank you so much, all, for being here, and most importantly, for those who travel all the way to be in Addis. As you stay here, most of the surgeons who are in this room, you came here for this conference, but I know, and most of the time you don't have time to look at yourself, to care for your body, to care for your mind, to think about what is the next step in life for me. So I would really invite you to take care of yourself, really self-looking and self-care. Get more connected, enjoy with each other, discuss, get out of the boundaries, and think out of the box, because the next trajectory for healthcare is in this room, and in the next generation is going to be paved in the discussions that we will have to come out from this one. Distinguished guests, Ethiopia definitely stands with the call for action that will come out from here on innovation, to lead in solidarity, bringing the Africa agenda, the Africa 2063 agenda, because together we can definitely build Africa where safe surgery is not a privilege, but a right. A continent where every mother is safe, where every child can come very safely to this continent. Every citizen can have an access for a very safe life-saving surgery, restoring dignity, and fulfilling the promises that everyone have in front of them. Thank you so much once again, and welcome to Addis Ababa, your home and the home of your ancestors.